Alright, so I'm just going to do a brief overview of mastitis in dairy cattle. So this occurs when the mammary gland and other tissue becomes inflamed and infected. So causes of mastitis. It's caused mainly by bacteria entering the teat canal and moving into the udder. There's specific bacterial examples. There are a stack more that, a list goes on and on. I just put a few examples. There are varying levels of mastitis, subclinical, which is where it's present but it's not obvious, you can't see any signs and symptoms. And then there's the clinical, which range from mild to moderate. Mainly is transmitted through the repetitive milking procedures. Symptoms: clots and lumps of flakes in the milk. You normally find this when you're milking through the system. They've got a little filter and you can only see it as when it's running through the filters, I guess. It's quite hard to determine. Changing milk colour, and then the quarter is sensitive to touch, it's swollen or hot.
Because it is inflammation, and one of the, does everybody remember the 4 cardinal signs of inflammation? Heat, pain, redness, swelling. And so hot, yeah. And the milk actually comes out hotter than the other quarters.
Treatment. So inflammatory antibiotic tubes are used. The cows are injected with an antibiotic into the infected quarter. There. Common antibiotics used: amoxicillin, penicillin, I don't know how to say that. Yeah.
It's up there, they can see the spelling.
Control prevention. So the milk is milked out, making sure that it doesn't go into the main lines. Otherwise, your entire tank is wasted, and you can't. It can't be collected by any of the trucks or anything. To prevention, cows are generally sprayed with iodine after milking. This helps to control the spread of any germs through the herd. And then general hygiene whilst milking, so wearing gloves, just washing hands, just general hygiene. And that's it.
Okay, so you're ready
Any
for questions?
questions?
Questions about mastitis?
Yep.
I know when I did a pedi-cow class and we had to do dairy farm out of the thing, they usually have you test it on your gloved hand, and if you see it, you're supposed to mark the cow and then litter.
Yeah. So they do. They will mark
Even
it
before they
big
put this
crosses, big
the milk
colours,
on.
so you do stop.
Yeah, so
They
there's a
can
way to
tell.
see the clumping if it's
Yeah.
bad enough, yeah.
Yeah.
But quite often they sometimes miss it though because it hasn't. It's the first time they've seen it, so till it, and then you stop.
Mm-hmm. Yeah, it's a,
That's called stripping the teeth, by the way.
yes, stripping the teeth, yes. And all 4 of them, yes. Now, do you guys know that the cow has 4 mammary glands?
Yes.
And they all operate independent of each other?
Yes.
Okay, good. So I don't have to tell you about that. Other questions? Oh, I know what. Here's what I got. Oftentimes, when you send in milk samples and get it analyzed for whatever it has, there's always an SCC. Eric, you're going to tell us.
What? I was actually
Oh,
going
you're
to
gonna-
ask that. I was going to ask it. Somatic cell count?
Yes. What does that mean exactly?
Leukocytes in the milk?
Very good, yes. Somatic cell counts are actually the leukocytes.
Do you know what number indicates mastitis?
He's giving me a quiz. Okay, who took pedi-cow and can tell me? Is it 100,000?
No.
Is it 1,000?
It's 200,000.
200,000.
But in the state of Indiana, you can legally sell everything and get like the premiums on your milk for anything below, I think, 750,000, which is way higher than.
Wow.
Yeah.
But you're saying the line for mastitis is 200,000?
For some medical.
Yeah, okay.
Usually you get around clinical like near 300,000.
Okay, because I was thinking it'd be ideal if it was 100,000 or less. I mean, that'd be
Yeah,
phenomenal.
Purdue Dairy, I think it's like around 70 to 100.
Yeah. So the thing is, there's always going to be some leukocytes in milk, but it's a matter of level. Any other questions or comments? We've got a rowdy crowd here today, but that's better than not.